Hello, I'm Liz, one of DRA's reference librarians, and welcome to another episode of Misinformation Busters. Once a week, we tackle a rumor or false, misunderstood information and try to separate fact from fiction. This week, we're talking about America's Frontline Doctors and their press conference. So, what's the story? On the afternoon of Monday, July 27th, the website Breitbart published a video of a press conference. The conference was for a newly formed group called America's Frontline Doctors and featured a number of doctors, complete with white lab coats, speaking out against the, quote, culture of fear that so-called experts are creating regarding COVID. The doctors also made a number of incorrect and unsubstantiated claims, such as hydroxychloroquine being a cure for COVID and that masks and social distancing measures are not needed. And this went against recommendations and claims from public health officials. Obviously, this video caught the public's attention. And while the group presented themselves as concerned medical professionals, the video also caught the attention of Facebook, Twitter, and YouTube, and was removed later that day for spreading misinformation. But not before it was viewed 14 million times and shared 600,000 times on Facebook, and even being shared by the president and his son on Twitter, and by high-profile celebrities like Madonna. So, what are the facts? First off, if I may speak personally, when I see a staged press conference featuring doctors wearing fresh lab coats and footage that is already edited and ready to be disseminated on social media, let's just say that sets off the skeptic alarm in my head. But we'll get to that later. First, let's take a look at the claims that they made in the video. Many of their claims can be directly refuted with evidence, the biggest one being that hydroxychloroquine is a cure and that states are suppressing the drug. There have been tests on hydroxychloroquine and other drugs like remdesivir and its effect on COVID patients. The tests are ongoing and, to be fair, there haven't been too many studies that have been peer-reviewed. However, based on the evidence that has been reviewed, hydroxychloroquine has been shown to not have much of an impact on treatment. In fact, in some cases, it may lead to unusual heart rhythms in some patients. This is a new disease, so researchers are testing many different treatments. No one is suppressing research. And there's been no suppression of the drug itself. What some states have done is put in place guidelines to prevent stockpiling of the drug, because even though hydroxychloroquine may not work on COVID, it is used to treat other diseases like lupus. And there was a lot of panic around COVID in the early days, and people were searching for anything that could treat it. Stockpiling could have generally hurt patients who did need it to manage their diseases. There was also a claim from one doctor that we don't need a lockdown, pointing to Sweden as an example of a country that did not have a lockdown or even many social distancing measures and had a low death rate. Well, turns out Sweden's lax policy did catch up with them. They may have had a slow growth rate in March, but that sped up in April, and as of July 28th, Sweden has the 8th highest number of coronavirus deaths per 100,000 people in the world, which is higher than two of their neighboring countries, Finland and Norway, who did implement lockdown measures. And across the world, medical professionals and disease experts have said, overall, the lockdown did reduce the number of deaths. Also, who are these doctors? Well, they are medical professionals, but they're not epidemiologists, they're not immunologists, who are usually the best people to consult on pandemics and diseases. And they're not even actual frontline doctors. They're urgent care doctors who they weren't seeing people during the lockdown. They're private practice doctors. They're ophthalmologists, pediatricians, professors. And again, they might be great at their field of focus. But just because someone is a doctor doesn't mean that they are an expert in every field. And in this case, they aren't even doctors on the front lines of fighting COVID. One of the doctors is Dr. Dan Erickson of the Bakersfield Doctors press conference fame, in which he downplayed the virus based on non-scientific sampling. And he was actually condemned by the American College of Emergency Physicians and the American Academy of Emergency Medicine. There's also Stella Emanuel, a pediatrician or primary care physician, her records are not clear, who has gotten a lion's share of attention due to some of her more outrageous claims. Will Sommer of the Daily Beast, an expert reporter when it comes to pseudoscience, found out that she has a history of believing in alien DNA and that gynecological problems like endometriosis are caused by sex with demons. So, not only would I take her COVID advice with a grain of salt, I'm not sure I'd want her as my OBGYN either. But let's put that aside and let's address her claims in the video. She claims that she has cured over 350 people using hydroxychloroquine. But remember, she runs a private practice, so she is not in a hospital. Patients being treated for COVID are usually in hospitals. How is she even coming in contact with these patients to treat them? And who are these patients? There are ways to produce proof of success without violating patient privacy, but instead, she refuses to show her results and just calls the other studies fake science. And what if the group's leader, Simone Gold? She's an emergency medicine specialist who, quote, offers private medical consultations. Her professional website has been deleted, but it looks like she has not been working in the front lines at a hospital. She has spent months advocating against lockdown measures and advocating for, you guessed it, hydroxychloroquine. She also signed a letter in April that pushed for the country to reopen. The letter was sponsored by the Save Our Country Coalition, which is a right-wing political group. She even spearheaded her own letter to the president and has been on numerous partisan talk shows to denounce masks, social distancing, and lockdown measures. She also wrote an editorial against masks, calling them, quote, a flashpoint for being a free human being who has consented to be governed but has not consented to be ruled. So piecing all this together, it looks like Dr. Gold's concerns may be more political than they are medical. And that brings us to the final point. When America's Frontline Doctors popped up out of nowhere with a very coordinated media blitz on a well-known partisan website, reporters asked, who is behind this? And it turns out the group is getting funding from Tea Party Patriots, which is a right-wing dark money group. Tea Party Patriots actually previously launched the Second Opinion Project, which was a website devoted to doctors attacking state and local lockdown measures. Obviously, America's Frontline Doctors have gotten a lot more traction. And frankly, it's not against the law for this to exist. There are plenty of groups out there where doctors lobby and advocate for political causes. For example, the group Physicians for Reproductive Health, which is a group of doctors who advocate for reproductive rights. But that group is transparent regarding their cause, while America's Frontline Doctors was not. The issue is not so much that they are partisan, but that they are not honest about it. They presented themselves as being an apolitical group of everyday physicians concerned about public health, all while being funded by partisan groups and appearing on a partisan website. For those who don't know, Breitbart does have a known right-wing bent. So I would say, in addition to the false claims and their false representation, the omission of their political agenda should be a cause for concern and, more importantly, skepticism. Thank you for watching, and as always, look for sources in the comments. And if you want to do some research, you can use our EBSCO databases available through the library's website. And I'll see you next week.